The one-step pregnancy dipstick test involves the use of a one-step pregnancy test strip. The test strip is dipped in the urine sample till it gets to the blue mark. The test device is then allowed to develop. Interpretation of results. For a negative result, one red line appears in the control region C, and no apparent red or pink line appears in the test region T. For a positive result, two distinct red lines appear. One line should be in the control region C, and another line should be in the test region T. Note: the intensity of the red color in the test region T will vary depending on the concentration of hCG present in the specimen. Therefore, any shade of red in the test region T should be considered positive. For an invalid result, control line fails to appear. This could be as a result of insufficient specimen volume or incorrect procedural techniques. In such a situation, review the procedure and repeat the test with a new test strip. If the problem persists, discontinue using the test kit immediately and contact your local distributor.